Let's get some common sense from Dr. Clay Golledge, an infectious diseases physician, who joins me again from Perth. Thanks for joining us again, Clay. Look, given what we've talked about over the last couple of years of variants and cycles, we should not be surprised about new variants and new levels of infections, but should we be alarmed?
We certainly shouldn't be surprised, Chris, nor should we be alarmed. So this is exactly what we expected. Coronaviruses mutate, they do this. They come in waves, not necessarily in winter. We're seeing exactly what we expected to occur going forward. So no cause for alarm, but also no cause for complacency either.
Yeah, look, I mean, if you're crook, you've got to stay home. And if you've got symptoms, whack on a mask. If you're vulnerable, you might want to wear a mask at the supermarket. That's all been in place already, right? This is just the way we've got to live.
Yeah. The overall message, Chris, is common sense. And this is where everyone kind of gets so caught up in it all, but have some common sense. Influenza is behaving in a more virulent fashion than is COVID at the moment because we don't have the therapeutics and the vaccines aren't as good. That's not to say that we shouldn't be fully immunised. And, disappointingly, still only about 30 to 40% of eligible Australians have only had their fourth vaccine. So we've got about 60% of people who are eligible but haven't had their fourth vaccine. And we threw out in September tens of thousands of expired vaccine doses. So this is really stupid that they haven't done this, because this does protect not against disease acquisition, I acknowledge that, but it protects against severe disease and stops you being in hospital for Christmas, which is what nobody wants. So if you haven't had your fourth dose, get it. If you haven't had your third dose, even more importantly, get it, and that will protect you.
Now, I've got no problem at all with chief health officers getting out there with information and making recommendations, such as the mask recommendation. But the worry is that we'll step back into mandates of various kinds. Surely we're beyond that, aren't we?
Look, let's hope so. I think if any politician tried to bring in a mandate, it would be political suicide for them. I certainly don't think it's going to happen over here in McGowan land, riding his wave of popularity. I don't think he'd want to see his popularity eroded by bringing in a mandate, because there would be massive pushback. As there should be, we should not be mandating anything like masks, nor mandating vaccines for that matter either, but strongly suggesting them. But if you want to wear a mask, knock yourself out. I am not a great believer in the efficacy of masks. I'd love to see us stopping wearing masks in the general hospital wards, but in the light of what's happened, I think we're still weeks away from that as well. So ordinary surgical masks, cloth masks probably don't do much anyway. So look, it's all about common sense. If you're sick, get tested. If you're feeling sick, stay home till you feel better, and then you can come back to work. So this is just another respiratory virus, probably less virulent than the influenza at the moment, that we just got to treat on its merits.
Thanks so much for joining us, Clay. I appreciate it.
Thanks, Chris.
Clay Golledge there from Perth, always a voice of reason when it comes to these issues.